So, for those of you joining us for the first time on Wellness Wednesday, a little introduction. We all, as a community of health conscious people, decided to come in one place and learn about health, especially um, how to prevent sickness. Our objective here is that what is our contribution to healthcare? What information did we not know to make sure that we are staying well? Everybody in this community wishes for a sickness free body. And then we also believe that the body has that innate ability to heal itself. And because of one or two things that we have done wrong, unknowingly, so we alter that innate ability to heal. And sometimes we run into chronic medical conditions such as hypertension, diabetes, obesity, arthritis, autoimmune disorders, and all sorts of things. So that's why we are here this night to just learn, just small information. And we keep the class not so technical. We keep it, so that if children are listening in the background, they can understand. So for the past couple of weeks, we've been focusing more on how do we understand the food that we are eating. So all of the last two lectures, we focus on carbohydrate. There's so many hidden carbohydrates that people are not even aware that it's carbohydrate. And then we talked about the fact that some people didn't know that beans is mostly carbohydrate with some protein. People didn't know a lot of things about carbohydrate. They didn't know that fruits are mostly carbohydrate. So you see someone eating beans and then looking for either pap or yam to balance the carbohydrate. Meanwhile, you've had a very balanced carbohydrate protein meal. So we talked about carbohydrate. And I think the takeaway from the carbohydrate lecture was that carbohydrate, they are not all the same. And the most important thing is the quantity. So we talked about the fact that if you go way above your limit, we even did a calculation on how much carbohydrate you need, on all of that. Then the excess of it, when you eat it, turns to glucose, and the glucose gets stored in the muscle, in the liver, and then fat, and then excess carbohydrate causes inflammation. And when you have a low grade, long term systemic inflammation, that is the manure for almost all the disease to thrive on. Obviously, disease can come from other sources, from handed down like a genetic disorder. It can come from many places, but we talked about how carbohydrate in excess turns into fat, causes low grade long term systemic inflammation. And the take home was you can eat carbohydrate, but don't overdo it. So that was the last two lectures. So today's lecture, we just decided, okay, since we know everything about carbohydrate, because it was like two lectures, let us try to know about the other macronutrients, which is we're supposed to know about fat. And then after fat, we are going to try and know about protein. So for then every time you go to your kitchen, you're free to eat anyhow you like, but at least you'll be conscious. So to summarize, the objective of this lecture is just for you to be conscious of what could be hurting you that you're not very much aware. And we call it silent killer that somebody's not aware. The last lecture, we mentioned that if somebody dies of diabetes, we will say diabetes, but nobody says somebody died of carbohydrate. But meanwhile, it was excess carbohydrate consumption, one, inability to burn off those carbohydrate, two, or carbohydrate had a major contribution to the diabetes, arthritis, and everything. But we don't say the person died from carbohydrate. We mention the disease. So that's why we are now taking it back home to say, okay, what are the contributors from our home end to make sure that we don't get into all this trouble. So that's where we've been in the past couple of days. And now we are going today's lecture, I will try my best to keep it brief. and just hit the nail on the head so that we can move on and go and practice in the kitchen. So that's what we're gonna do. All right. So once again, welcome. I'm going to switch over to the Zoom. I'm sorry, the lecture. So I'll swap over to the lecture. Welcome. It's good to see you. So I'm going to press share the screen and then take you there. Screen, start broadcasting. Okay. So because of the noise in the background, I'm gonna mute everybody. Hang on. Okay. Okay, so we are sharing screen and I've muted all. So here's our sweet little lecture on, hang on 1 second. Hang on. Oh, I opened the lecture before and now it's, hang on 1 second, please. I'm with you just to get the lecture out. Alrighty then. Okay, I had closed the tab. Sorry about that. Okay, so I'm going back to sharing my screen. Start. Okay. Okay, I think it's sharing. Okay. Okay, so once again, good evening and welcome to Wellness Wednesday. My name is Dr. Susan. You all know me. And no need for a long, lengthy introduction. I am crazy about preventive medicine, and I also have a master's in preventive and promotional medicine, amongst all other degrees to support my teaching. All right, so the highlight of this lecture is actually to clarify the role of fat in the body, also highlight dangers of excess fat. Remember, as we talked the other day on carbohydrate, it was about either excess or deficiency, because there's something like undercarb. So like if you go less than 60 grams of carb a day for a long time, you can actually get sick, etc. So we are going to just talk about fat today. So fat, is it friend or foe? Okay, so I'm going to only read this part and then I will now explain, okay? It says this fat, because especially skinny people, they eat tozo and drink oil anyhow they like because they didn't see it visibly in their body, but it doesn't mean that it's not affecting them. And we'll find out today. So fat is one of the most misunderstood and controversial topic in nutrition and wellness, one of them. And then, contrary to popular belief, fat is not only a concern for people that are overweight and obese. Okay, even slim individuals, including children, can suffer from fat-related health problems, such as what? High cholesterol. In fact, in the clinic, in the Dr. Physique clinic, I've noticed that the majority of people with high cholesterol, they're actually skinny people. I wish another lab will confirm that because we have a lab in-house, like a full-blown medical diagnostic center, and we do all these things. So I don't know, but a lot of fat people, and I think it's because they're not very conscious, not knowing that the fat can be stored around the organs. They have things like fatty liver, etc. So fatty liver, hormonal imbalance, cardiovascular diseases, the skinny people have. You know that someone so skinny, the person was in a stroke, and you're like, stroke, and the person looks so slim and slender. Where did the fat come from? Say stroke is supposed to be for fat and obese people. So fat people, skinny people have fat issues. like that. So fat, the one we know is fatty bum bum, big belly and all of that. But that's not the one that's not the only one killing people. The hidden fats inside the body that, block the pathway of blood flow, causing inflammations and everything that can accelerate death, cause insulin resistance, etc. Now, so this makes fast a universal health topic, whether you are thin, overweight, athletic, sedentary. You just have to understand what fat is all about. So, what is this fat? Well, fat is one of the three. Before I mentioned that we have three main macronutrients. Three. We have the fat, we have carbohydrate, and protein. We will talk about micronutrient after we are done with macronutrient. So, and so you can see here, it says alongside carbohydrate and protein as macronutrients. So we have three macronutrients mainly. So we have fat, we have carbohydrate, and we have protein. Now, the body needs fat for several reasons. So, what are the health benefits? Why did God even invent fat or why are we eating fat? Here are the benefits. Fat helps for energy production. So, the same way you eat carbohydrate to get energy, okay, fat gives you energy, even though it's not as fast in terms of the glucose that hits your bloodstream and instantly you have energy. And that's why if you have hypoglycemia, like your sugar level is low and you're weak, they give you Coke and stuff so that kind of carbohydrate, it hits fast. But we should not misunderstand the fact that while a gram of carbohydrate gives us only 4 calories, 1 gram of fat gives us 9 calories. Let me repeat that. While a gram of carbohydrate, even protein, 1 gram gives us only 4 calories of energy. 4 calories. Each gram of fat gives us 9 calories. So you can see that fat is very nutrient dense or energy dense or calorie dense compared to carbohydrate and protein. So what is the take home? The take home is that, okay, by the time I'm done, you see that every time you eat rice and stew, when they scoop that one a spoon of stew and pour it on your rice and beans or whatever they pour it on, or you're making egg sauce, I want you to have an idea of what you're actually doing to your body. That's not to say, like I said, you see, fat is good, so you must eat fat, but you need to know which fat and then also how much fat. If I just even achieve that objective, that you know three things. Number one, what's your limit? Number two, which fat? You understand? And then number three, just a general understanding. I think we have gotten something rather than just watching Telemundo or whatever. People relax a bit in the evening. So that's that. Now, another function of fat, why God put fat, is the cell membrane structure. It also has fat. And if you hear, like, even in some medicine, when they are giving drugs, they will say, oh, is this more of a hydrophilic, hydrophobic? So will it penetrate the cell? Will it cross the cell membrane and all of that? Then the brain is all fat. The nerves, the myelin sheath that covers the neurons is all fat. It's surrounded by cholesterol of some kind. Okay, so the brain is all that fatty. If they smack your head and white things are coming out, it's all mostly fat, cholesterol, and stuff like that. Fat again helps to absorb for you to absorb nutrients. So anytime you're taking vitamin A, D, E, and K, you can't absorb it if you don't have fat in your body. So we say ADEC. So you can see the importance of fat even in absorbing vital nutrients. It helps with hormone production like estrogen and testosterone, and also insulation. You notice skinny people are more cold, except you're having hyperthyroidism, then okay, that's a different story altogether. But skinny people, they're always cold. But fat people, they don't get as cold because they have a lot of insulation. It's like a blanket directly underneath the skin and also suffocating and choking up organs and stuff. So they get a lot of insulation. So like I said before, not all fat are harmful. In fact, fat is essential for survival. So at the end of the day, someone say, "Hey, Dr. Susan, we cannot eat carbohydrates, we cannot eat fat." No, we are not saying you should not eat fat. You must eat fat because fat is necessary. People even use olive oil to reduce diabetes. I mean, people use fat to lose weight. So it's how you're going to use the fat, but that is a story for another day. So fat is important, it is essential. The body needs fat. So we have talked about that one. Okay, now let's talk about it again. What type fat? So there are different types of fat. We have unsaturated, we have saturated. I don't want to overly get technical, but just know that when you hear unsaturated fat, just know that it's more healthy. So olive oil will be there, avocado is there, things that give you omega-3, those healthy oils. Okay. Now, saturated fat, butter, and stuff like that. You can see here palm oil, they say it's saturated fat. I don't want to do a palm oil lecture today. In the past, throughout my stay in the United States, and even for a long time, we heard that palm oil was so bad for you, this, that. The same people now did another study. It was on Oprah Winfrey's show by Dr. Oz to show that right now in the world, palm oil is one of the richest and healthiest oil that anybody can take. Now, remember, it doesn't matter whether it's good or bad. If you take it in excess, you're still going to get into trouble. But lately, palm oil and even coconut oil, they used to say a lot of bad things about coconut oil. So that, I don't know, maybe they wanted Africans not to know the benefit of palm oil so they can turn it into other things and send it back to us, or I don't know why they give such a bad publicity, but I want to believe maybe they didn't know. Okay, so I don't want to join people that talk anyhow. Maybe they truly didn't know. Maybe they know. I don't know. That's not my position. My position is that lately, all I have learned on palm oil shows that palm oil, when used in good quantity, is actually a good fat alongside coconut, and which both of them in the past were part of bad fat. We now have trans fat. That one is a no-go area. So you can totally avoid all these baked good, lard, margarine, or fried snacks and stuff like that. You can totally avoid it. Okay. Let me see if I can cut out the the noise in the background. Hang on. Let me see. Mute all. Yes. Okay. Perfect. Okay. Let me make sure that I'm still sharing the screen. Okay, the screen I'm still sharing. There's another one. Okay. Okay. So as we are talking about this fat, so where are they hidden? Take that one there. Where are these fat? Where are they hidden? They're hidden everywhere. The first place the fat is hidden in your body is called subcutaneous fat. So directly beneath your skin. If you notice that some medicine they say, oh, give it subcu. Take give it, they will say give it subcute. I don't know whether you've heard it. It means just beneath the skin you give that fat. So that is one. Then there's another place it's stored. It's called visceral fat. This is the one that skinny people are suffering from the most. It's stored around your internal organ, suffocating your liver, your heart, your pancreas. Sometimes the pancreas is so suffocated by fat that even the insulin and it's not releasing insulin properly. So in the clinic, when we do a little bit of weight loss, you see like the sugar level picks up. Okay, so this is the most dangerous kind because it's just hidden inside and you don't see it. And then, of course, we have the intramuscular fat, which is within the muscle. Like even in goats, goat meat and all this meat that we eat, you know, you cut it, you see within the muscle of the goat, you'll be seeing fat stuck inside, okay? And then maybe if you cut a chicken, if you bring out, like, let's say the kidney, the gizzard, the all those chicken parts, you see, you know. So I'm just trying to bring in home so that you can see that it's the same thing that happens for the body. And then on the animal, you see just beneath the skin, that first layer that you see fat. Like sometimes if you mistakenly cut your hand, you see something yellow, yellow like that. It looks sort of like this. So that is fat. That is so this is where the fat, this is where they are stored. Last week, when we talked about carbohydrate, we said that sometimes it's stored as glucose in the liver, the muscle, and then they get transferred and stored as fat. This is where all these fats are hiding in your body. And if you now take excess of oil, it's still gonna be stored as fat, etc. So this is where fats they are stored inside your body. Now, for some people, they'll start asking, "Oh, Dr. Susan, how do we calculate?" Here's a calculation, but you know, this lecture is not supposed to be technical. But I will just say it just because there are some very learned people that already have the background, you know, so they will appreciate it. But my own is that for the average person who just wants to be healthy, like myself, just know that your average caloric intake, which we said the last time is around 2000. So if you're like the average person taking the average 2000 calories per day, um, your fat maximum should not be more than 55 grams. Should not be more than 55 grams. And remember, we said each gram has nine. So can somebody help me? 55 times nine is what? So like that. Okay, so the math is already there, but let's look at it together. Okay, so to determine how much fat you need in a day, okay, you take it and then you multiply it by 0.25, which is 25%, and then you get 500 calories from fat, and then you divide it by 9 because of the 9 calories per gram of fat, and then you can get a total of 55. So what do you want to take home from here? Take home that the average person should not eat more than 55 grams of fat in general. Now, there are some people that are too skinny and the doctor prescribe high fat food. That's a different story. And there are some people that are on excessive weight loss program and the doctor will prescribe a low fat diet. So from the low fat diet is about 25 grams or less. But if you're the average person eating to maintain your health and your size and everything, and you're on a 2000 calorie food, then you take 55 grams of fat. Okay. Now, this is the part that everybody likes, and this is the part I like most also. Okay. Number one, is there fat in moi moi? You bet. So one wrap of moi moi, a big one like 200 grams of moi moi, will give you 15 grams of fat. Okay. Now, if you want to eat moi moi and fried plantain, if you know that small cup, okay, which is about 150 grams of dodo fried plantain, you get another 20 grams of fat. Remember, you're on 55 if you're maintaining. If you're losing weight, 25. So if you're on a weight loss program and you eat this size of moi moi and plantain, then it means you've maxed out your fat for the day. But let's keep on going. If you now do jollof rice, you're going to get 12 grams of fat, assuming it's just one cup of, nearly dried jollof rice. But the way they make jollof rice with a lot of oil, it varies, okay? One of the things that the biggest one I want to highlight today, okay, is groundnut. So I don't know why people just think of groundnut as nut, but groundnut is mostly all oil. Half a cup, and I know somebody that consistently finish one bottle. If the bottle is not finished, the person will not rest, and join it with banana. Now, half a cup, this small cup that half of it is 70 grams of fat. I'm sorry, no, 70 grams of groundnut, which gives you about 40 grams of fat. So if you eat like half a bottle or quarter bottle of groundnut the way we eat, you've already done your 40 grams of fat. And 40 grams is the average for, especially for sedentary lifestyle people, because you're not gonna burn it. Remember what we said, anything you don't burn will stay back to burn you. So there's a lady that came to the clinic and she's like, "Oh, Dr. Susan, I don't know what is wrong with me. I'm always gaining weight, my sugar, this, that. I don't even eat carbohydrates." And I now said, "Okay, so what do you eat?" First of all, I hope she attended the carbohydrate lecture, because the things she did not call carbohydrate is all she ate. So she does a lot of banana, pineapple, but her lover is groundnut. So she's the one that said that if she buys, so she buys smaller quantity. Now, if the bottle is not finished, she cannot stop. Then number two, we found out in our diabetic clinic that groundnut, of course, it's a legume. I don't know why it's called nut, but it's actually spikes blood sugar for majority of diabetics, like 70%. It spikes your blood sugar. I don't know if because of the too much oil or maybe because they are taking it with sodium. I don't know, but it spikes the blood sugar. Someone can challenge me and try it at home. So it's from experiment we did in the diabetic clinic. For my mother, it spikes her sugar also. So that's why I brought it to let everybody know. So you can eat groundnut, but eat and watch. There are some people that it will not spike. I mean, when you run a diabetic clinic, you now see all manners of things. I have somebody who ate rice and the sugar was coming down. Another person ate beans and the sugar was going up. So I don't, the summary, what we teach on this platform is you watch, you don't overdo, but you do and watch. And then you do and test. Okay? Akara. For those of you that are akara lovers, this akara, once you eat it today, there's one craving that will come for tomorrow and you keep going. So if you get four small akara, 20 grams of. So imagine that you've had just four small akara. You've maxed out your oil for the day now, if you're a sedentary lifestyle worker. So you can see that majority of Nigerian people, we are always above our fat limit. So, and now the science says that whether you're fat or skinny, this fat is affecting you, whether you're fat or skinny. Then again, we spoke in the last lecture that we all have different metabolism, where some people have a very high metabolism, some people have a low one, but 1 gram of fat is 9 calories. So if you don't burn it, it will stay back to hurt. um egusi soup. Egusi soup is like eating stew. Egusi soup, 1 spoon plate, a wrap and a soup of egusi soup, you've already done 40 grams of carbo, I'm sorry, fat. 40 grams. Remember, if you pass 40, 50, you're already starting to do damage. So let's reduce it. I think as a general rule, I think Nigerians, no matter how much oil you reduce, you can't really get away from oil. So I think we should generally just be cautious and then take it from there. Other Nigerian food. Okay, please, everybody should pay attention to this. Even if you didn't memorize any other um, slide, this one you have to know it in your heart. Averagely, because if you know this, then you don't need me for anything else, as long as this one is concerned. Averagely, a tablespoon of oil, any oil, averagely has about 120 calories. So now think of it, any stew that you eat with rice or egg sauce, you know for sure that they've already used more than a tablespoon of oil. I'm talking averagely, not the health conscious people like the people on this platform. I'm just showing you what is happening to Nigeria. So 1 tablespoon of olive oil, coconut oil, palm oil, averagely is about 120 calories of fat, not 20 calories of carbohydrate or protein, of fat. You can imagine. Now, The average stew that they put on an average plate of rice will contain no less than 2 to 3 spoons of oil, whether it's groundnut oil, olive oil, or whatever. So if you're doing 2 to 3 spoons of oil to eat your egg sauce or whatever properly, look at it now. Or maybe you're doing palm oil with boiled yam. So nobody that I know eats palm oil with boiled yam with only 1 tablespoon of palm oil. You must put at least 2 or 3, put salt, pepper, and whatever. So it means you've already done like 360 calories only from the oil. We did not include the carbohydrate. We did not include the carbohydrate. And then it means you've already done almost 15, almost 45 grams of fat. We did not include the carbohydrate. So if you understand this slide as you leave this lecture today, I'm happy. So anytime you're cooking, if you want to fry your egg, don't just take the spoon and take 1 tablespoon of oil to fry your egg. Automatically, you know that there's oil in the egg too, but we will not talk about it because I don't, it's not part of this lecture. There's this question about good for you and this and that. It's another lecture altogether, and we will get to it because this lecture is all about spending about 45 minutes to just understand better what we are doing at home. So what is the take home? You want to fry your egg or yam or anything, 1 tablespoon, measure it. If you put about 3 so that it can cover the bottom of the pot, so you have done 45 grams averagely of fat. And if you multiply that, that's 360 calories. And remember, we said averagely you can live on 2,000 calories per day. But if you're a sedentary lifestyle person, it should be less than 1,500 because anything you don't burn will stay back to burn. So that's that. So I hope this slide is clear and just to have it in mind, okay? So that being said, this one is sources of good fat. In general, if you're getting sesame seed, avocado, fish, olive oil, coconut oil, palm oil now, and all of those, they are just pretty much good, good for you in general. Okay, boiled beans naturally has low fat. Most beans, that is why you hear bean oil, soya beans oil. Um, what's that one in Igbo land? Uba has bean oil. So most beans they have oil. So that is that. Okay. All right. The ones that you should deliberately avoid, okay, fry. So we are saying too much of fried. Boiled beans is better than fried beans. So that is akara. We set like 4 small balls of akara. You know what will happen to you. I just showed you here. Let me go back to that akara. 4 small balls. You've already done about 300 calories and 20 grams. So, and then you fried it. Which kind of oil? You never know. Maybe it's even trans fat that we are talking. So generally, if you eat akara as a delicacy, here and there, don't overdo it. Suya, because of the tozo and the rest of them. But if you have lean beef, it's still healthy for protein. But you know that majority of people at home, they prefer the fatty aspect and the skin and the tozo, etc. Puff puff. Last lecture, we taught that each puff puff is nearly equivalent to a slice of bread. So yesterday I saw the person that was driving me said, I'm a little bit hungry. Let me just grab something. And the person bought 5 puff puff. And I told the person, you've just had more than 5 slices of bread and bought a bottle of Sprite. Not even carb conscious. So this lecture is about carb consciousness, not elimination. Fat consciousness, not elimination. As I've mentioned, there are very good fats out there. Okay. Nkwobi is because of how it is prepared. And because nkwobi because is animal fat. So, and it's a lot of animal fat, except there's a skinny nkwobi on diet. I don't know, but the nkwobi I know is pretty oily, fatty, with kaun and or what they put. I hope I pronounced that properly. Limestone. Fried yam. Why? There's nothing wrong with yam, but we're talking fry. Ching ching, biscuit, all of them. In general, these things should either be avoided or eaten sparingly. So you can do it once a week. It should not be your daily bread, because there are some people who say, Dr. Susan, ching ching is my food. There's some people, there's no day they will not have biscuit. So, and biscuit, they make it with lard and really bad carbohydrate, all processed. So what is the take home? Please let us be conscious so that we can eliminate sickness. Okay. We've already said that fat is good for the body. It helps to absorb vitamins, etc. Um, um, if you have too much fat in your body, you're at risk of clogging of clogged arteries, high cholesterol, heart disease, um, non-alcoholic fatty liver disease. So we have fatty liver, we alcoholic fatty liver disease, and we have non-alcoholic liver disease. Then we have obesity, increase in fat. When you overdo it, trust me, this is what comes out. So, almost finishing up, we have hidden fat. This is for the slim people especially. Some individual may appear slim. This one man, he was in a coma. I mean, he had a stroke, went in a coma, etc. The only thing that was bad, the BP was fine, no. The only thing that was bad was fatty liver, excess fatty liver. I have never even seen that much before. The person is very skinny. So there could be other things that, cause that. But I'm like, this person is so skinny, but look at the amount of fatty liver. Okay. So the point is that skinny people should pay attention to this, because fat will affect skinny people in terms of high cholesterol, in terms of BP, in terms of insulin resistance, okay, um, in terms of developing a metabolic syndrome. Being slim does not guarantee being healthy. No, it does not even guarantee being beautiful, because in the past, when you're skinny, you're a supermodel. But you know what? It's not like that anymore. The most important thing is when you do your labs and everything is intact and you have the best energy to do what God put you on this earth to do, to actualize your mission, your purpose, and become the fullest expression of yourself and your potential. I think that is the name of the game. Two, we also want to live, we want to lead, we want to leave a legacy. And you don't want to leave a legacy and be watching it from wheelchair. We don't want that. Yes, accident things happen and people get sick, but this lecture is about how do we help the hospitals? Because if we just sit and know nothing and do nothing, we will ever just always end up on lifelong drugs, admission, surgery. As I always say repeatedly, I'm a medical professional, so there will ever be a need for doctors, nurses, and all of that. But we too, we have a contribution to healthcare, and this is why we are here. Um, so can eating fat make you fat? Not necessarily. Not necessarily. The answer is weight gain results from eating more calories than you burn, regardless of source. So whether the calories is from protein, is from fat, is from carbohydrate, is the excess that is the problem. So fat in general is not for fat gain, okay? But excess, what your body cannot burn. We've said your limit is 55 as a normal person. For someone losing weight, you should cut that by 2 and do less than 30. If you go more than that, or you're okay. So, however, unhealthy fats, all these unhealthy fats, the ones I mentioned, they're not very good, but we can focus on healthy fats such as, salmon, fish, which is so expensive. Sardine has very good fat. Almond nuts, avocado has very good fat. These ones are bad fat, the ones on the bottom. Okay, what contributes to fat storage? Sedentary lifestyle, hormonal imbalance, all these PCOS, poor sleep. If you're not sleeping, you'll be making fat. What can you do about it? Well, choose healthy fats, portion controls, and get quality sleep. Okay, even healthy fat can be harmful. Oh, I just say you can eat healthy fat. Healthy fat can be harmful. The question is how. Okay. Not all fats are created equal. So healthy fat on olive oil, avocado, seed oils like that are healthy. We've talked about the unhealthy ones, which is like the processed and fried and all of that. However, too much of even the good fat will still lead to weight gain. It will still give you fat accumulation. So healthy fats are calorie dense. Remember, that is how I started the lecture, which means 1 gram has 9 calories. Meanwhile, carbohydrate has only 4. Meanwhile, protein has only 4. 9 full calories, and without portion control. And then don't forget the one I told you to remember, which is that 1 teaspoon, 1 tablespoon like this, you're already at 15 grams of fat. So we need to calm down with the fat. A tablespoon of olive oil, 120 calories, avocado. People love avocado. Oh, it's healthy, it's healthy. Are you kidding me? Yes, it's healthy, but if you overdo it, you still have to burn it off. If you don't burn it, it will stay back to burn you. Um, okay, so how can your body tell you that you're doing something wrong? Like that woman that came to the clinic and was overdosing on a bottle of groundnut on daily basis, the BP will not come down. Because I told her to bring a bottle of groundnut so I can taste it. The salt amount, she said, oh, I have this special supplier. See, the thing is very crunchy. I ate it all. Salty. It will just be making you to think about whether they add Maggi inside it. I don't know. But, people will do anything to sell their market. But it was a very unique, crispy like groundnut. And she got
bá mi gbé wá jọ nítorí ọlọ́run bá mi gbé wá sọ́dọ̀ mi. Let him disturb me.
No audio, no audio. No audio, please.
We're reading the screen, but we're not hearing your voice.
I think her network has gone off. It's just rolling. Doctor, please, we are no longer hearing you.
We can't hear you, ma. Network is gone.
Doctor, we can't hear you again. No, please check your network.
Oh, too bad. The network is really showing us this night. I can't hear you. Anymore. Thank you. Nice work. Leave it there, don't wake him up. You don't want me to beat you. Oh, no. When you go visit the purpose of it.
Mary, if you open it, I'm going to beat you.
It's not
Because
even
you
waiting
don't have
for
you don't have ears to listen. You didn't wash your hands. You want to put your hand in it.
All right. I don't know why that that happens all the time. And I need to talk to my team if there's another thing better than Zoom, because we upgraded our package so that we don't have any interruptions. So we are done with the lecture. So please, if you have any question, kindly ask. And when that happens, it wipes off all the questions that you had asked. So unfortunately, I don't have any question on the chat and I cannot answer any question. So please, I'd like you to, if you have need any clarification, have any question, and I just pray that the lecture helped you, even at least to just pay attention to fat consumption going forward. Thank you. Okay, someone asked, is boiled groundnut good? And the answer is yes. Boiled groundnut is still groundnut. So you still have to eat it in moderation. So yes, groundnut is groundnut, whether it's boiled or fried or anything. But for me, boiled groundnut, if you don't put too much salt, should be better than the fried one. Boiled groundnut is still groundnut. It's still groundnut. So you have to eat it in moderation. So yes, groundnut is groundnut, whether it's boiled or fried or anything. But okay, so somebody asked, is catfish okay? So catfish is very, very okay. It has a very high protein. However, you have to be careful because it's grown in a pond and some people put hormones and stuff to make it grow faster. So if you can get the one with the proper feed, it's still okay. But when we are talking about healthy fish with oil, catfish is not inside it. Okay, so someone asked, Dr. Susan, what can you do if you have a mild non-alcoholic fatty liver disease? So for me, hot water therapy with lemon or apple cider vinegar does it. First thing in the morning and at 6 p.m., that is 2 times a day. Then there's a product called milk thistle. You take that milk thistle. In the pharmacy, they call it silimarine. So naturally, those are the two things. Then the third one is just to deliberately lose about 5 to 10 kg. So if you deliberately lose 5 to 10 kg, you do hot water therapy and incorporate milk thistle. 99% of the time, it will either disappear or get better. Okay, you're welcome. So I cannot hear anybody, so I don't know if you're there.
So, good evening, ma.
Hello, sir. Good evening.
Thank you for your wonderful lecture.
Sir, you're eating your fat here so that we can see you.
No, I'm just taking some little almond nuts.
Okay, sir.
Some oil. I used to use some oil in the market. No cholesterol.
So you're eating your fat here so that we can see you. Say it again. Okay. What is your question? Okay, sir.
Some oil in the market, they say no cholesterol.
Yes. Okay, so I think you're asking that there's some oil in the market, they say no cholesterol, right?
Yeah.
Are you asking if it's a good or bad or what?
No, I'm talking because sometimes people want to, because they say no cholesterol, and then use it. I just believe that oil is immense oil. One way or the other.
Your thinking is correct. That is just a marketing scheme. So it's like you see biscuit or a juice. The juice is sweet in your mouth. It says no sugar added. It means that it came from a concentrate that already had sugar. They did not add extra sugar. But does it mean that it doesn't have sugar? It has. So you see some oil on the market, they'll say no cholesterol. There's no cholesterol in plant-based oil. So if you notice that oil will be something like either soybean oil or whatever. Because the whole idea is that it's animal oil that contains cholesterol for the most part. The plant-based oil has 0 to no cholesterol. That's the whole point. So they now say, let us deceive people that don't know better. They now put no cholesterol. It's just, for me, I think it's just a scam.
I think so too.
So treat that oil exactly like the one that doesn't have a label of cholesterol or not. That's just the answer. Thank you, sir.
So this from the lecture, I think because I think avoidance is one of the best answer because portion control is difficult to.
So, but we cannot do without fat.
Yes, I know.
So you can't totally avoid it.
Uh,
It's just to be conscious that every spoon of stew completely that you ate, you've maxed out your oil for that day. So to know that if this food that you're looking at contains more than a tablespoon of oil, then you've maxed out your oil consumption for that day. So small things like that.
okay. I use more of sauce in my rice when I want to eat any red rice. I eat sauce.
Yes, I think everybody should adopt that. Yeah.
Vegetable sauce.
Yes, sir. Thank you so
Thank
much, sir.
you.
All
Hello,
right, sir.
doctor.
Yes, dear.
Doctor. Okay,
Hi.
now that there is a lot of oil in egusi soup or egusi
Yes.
generally, how
Uh-huh.
do we now cook egusi soup? Because sometimes, you put a lot of oil, palm oil to make it, look beautiful and, the sweetness is there. So now, how are we going to do with this egusi soup? Is it to cut off, preparing egusi soup?
Well, the way I will approach egusi soup is simple. Number one, I will eat egusi soup maximum once a day. And on that day, I make sure that everything else I eat is not too much oil because one portion of egusi soup you've already maxed out. Number two, people don't understand that the egusi seed itself is all oil. So now, if egusi soup is all oil, and then you now add the oil inside, then it's a double whammy. So everything in life is about choice. That is why I rather what is in egusi and eat the egusi soup consciously than not even know and follow the sweetness and be going to where I don't want to see you. So there's nothing I can change. Palm oil is palm oil. Egusi is egusi. Both are oil. Just like groundnut is oil. I didn't create it. And that's why it tastes so good. So that we can miss road. So it's just to be conscious. There's nothing
Okay.
you can do. Yes. Some people are now cooking egusi with tomato to make the color a little bit red. Then
Yes.
after that, they now put small olive oil after they bring it down from fire. So I know somebody
Okay.
so you just find a way. But for me, I rather enjoy the egusi, very small portion, maybe once a week, and know that the rest of the day is salad to balance it out.
Okay.
Something like that. Yes.
Okay. Thank you very much.
Thank you. Somebody says the real kuli groundnut is it good? It's still groundnut, and it's even worse because I think kuli is even fried. So, so that is that. Just treat it as groundnut. Doctor, how do we flush any of this fat excess? Like I said, hot water therapy is good with lemon or apple cider vinegar. You can avoid eating it. You can exercise to burn up some fat. And then any fat you eat in the night is worse because it will be stored. And that is that. So, because it is 9 o'clock and um, we've, I think, yes, it's 9 o'clock. If you have any further questions, I can take two more questions and then we have to call it a night so that people will want to come to our lecture and know that we'll finish at 9. Okay, is there any other question or do we call it a night? Okay. They say going once, going twice. I want to apologize once again for the network. I don't know why that happens. I have Wi-Fi, I have normal network. I'm using the best of network and sometimes these things happen. So sorry if there was any interruption. And lastly, I pray for you all the time and I wish you well. And I pray that just spending this hour with me, God will increase your health and your little effort will be God will maximize and crown your little effort so that you can have this sickness-free body and then help to take away, even if there's disease already, that God should remove it. So that's my prayer for everybody. Have a good night. God bless you. And we will see next week. Have a good night. Thank you.
Good night. Thank you and God
Good
bless you.
night, doctor.
All right. Thank you. God bless you. Good night.
Good night. Thank you.
Yeah,
Good
good night.
night. Okay.